Sally Walker here, your hormone and slow age expert. Let's talk about erectile dysfunction, also called ED. So what is it? Well, it is the inability to sustain an optimal erection to perform your sexual activities as well as you'd like to. As satisfactory is another word, isn't it? So back in the day, it was presumed to be of psychological causes, but today we know it very much is a physical cause, and a lot of it to do with blood flow. And there is some studies suggesting it actually is an indication, a warning of coronary heart disease, that the penis gets affected before your heart if you have problems with your blood flow. Okay, interesting, isn't it? Yeah. So how prevalent is it? Well, back in 1995, an estimated 152 million men worldwide suffered with ED, and it is now estimated that by 2025, an estimated 322 million worldwide males will suffer with erectile dysfunction. So it's important, isn't it? And it's not just the psychological part of it, though. I mean, obviously having challenges with ED will create immense psychological problems. But risk factors, so things like prostate disease, so it could be enlarged prostate, it could be inflammation of your prostate, it could be cancer of the prostate. But if your prostate starts going wrong, then erectile dysfunction usually comes hand in hand. Type 2 diabetes. So type 2 diabetes affects blood flow, and especially in the small vessels out of the periphery, like your toes, like your kidneys, like your eyes, and boys, like your penis as well. So you don't want to get type 2 diabetes. Nobody wants to get it, but especially you boys related to your penis, you do not want to get type 2 diabetes. So check out my other blogs and get information all about how you can prevent type 2 diabetes, because it is a lifestyle disease. So get the right lifestyle and you will maintain erections. So you can look at it in that way as well. So hypertension, so check your blood pressures, people. So this is another big problem. This is an indication of vascular disease, obviously, heart disease. High blood cholesterols maybe also play a role. Chronic sleep disorders, there are certain medications and drugs which are going to affect it as well. But the biggie is the blood flow, okay? So if you have problems with blood flow, then this will probably be the cause of your erectile dysfunction. So you want to know what you can do about it. So I have written an article in this blog, so check it out, all about erectile dysfunction, all the different types, because we've got different types. So you have a little look at those and see if you can find some solutions to what you should be doing to improve your erections or to maintain them so you don't get problems with them. But I suppose aging is also on the list, isn't it, of a risk factor, because obviously the older that you get, boys, and the more likely it is that you will suffer with erectile dysfunction. Anyway, check out the blogs. Happy hormones, happy life.